Good afternoon, everyone, and welcome to the opening ceremony of the new Park City Primary Care Center. So before we continue, I'd like to ask Dr. Reverend Anthony Bennett, pastor of Mount Airy Baptist Church, to provide the invocation.
It is our prayer that as we cut this ribbon, as we celebrate this day officially, that it is just a reminder of your presence, your healing presence in this community. In the name of your Son, Jesus, I pray. Amen.
Next, I'd like to introduce the Chief Executive Officer, Mr. Ludwig Spinelli of Optimus Healthcare, for comments.
It's a very exciting day for us to be here. I just want to recognize many of our partners, and I don't want to overlook anyone. Very quickly, we have a number of CEOs of nonprofit agencies who are our partners and work very closely with us, including our colleagues, Southwest Community Health Center, Rudy Fido from GBAP, Janice Kelly from Bethel Recovery. We have Jim Pashota representing the state of Connecticut, Department of Health, Demas, and we also have Alan Mathis from LNG. We have John Hamilton from Regional Network of Programs. And if I left out anybody, let me know. We have a number of nonprofit executives, the Area Health Education Center. We can't forget that as well.
And thank you, each and every one of you who have come to celebrate this incredible achievement. Lud, the board, and especially the hardworking medical staff who dedicate their time and energy to that simple, spiritual, ancient injunction that we heal the sick. And you do it, of course, for those who don't have other options, who don't necessarily have a family doctor, who don't necessarily have the resources that they can fall back on in sometimes the most frightening moments of their lives. So thank you for that. We talk about stimulus, the American Recovery and Reinvestment Act, but at the end of the day, this beautiful, gleaming new facility with its new examination rooms is going to be about saving and improving the lives of people who don't have a lot of opportunity.
I love events like today because we get to say thank you for all the things that we every day take for granted. We take our health for granted. I see everybody here looks very healthy. And let's just say thank you for being healthy. Let's say thank you for Optimus and Southwest. Janice, you go, girl. There you go. So I love events like this because we take these things for granted all the time. And I want to tell you, I don't take my congressman for granted. I want you to know how important he is. To me, to you. The Congress Street Bridge stood forever stuck open. No matter what we did, we couldn't get help. We got help from the stimulus because of President Obama and Jim Hines.
Thank you, Mayor Finch. Really, the work we do here is, as both Congressman Hines and Bill Finch, Mayor Finch mentioned, is directed really toward one outcome, and that's to improve the patient's health, improve the health of the public. So the next individual I'd like to introduce is Pamela Womack, who will give some comments in terms of community response. Pamela.
I came here 2 years ago, and I didn't know what I was getting into. But I tell you, 2 years later, I'm still here, because this is a beautiful, beautiful place to be. The doctors and the nurses, the staff, they treat you the warmth that they talk to you with, the respect and the dignity. I love it. This is like having my own private doctor, instead of going to a clinic. And I just want to tell you, I thank you. I'm a healthier person today behind this place, and a happier one. And my mother is too. And it's just, if it was left up to me to rename this place, I would call it a slice of heaven. Because everyone here is so wonderful. And I know now God truly doesn't make any mistakes, because everyone here that I've met is just beautiful. And I just love you all for that. And another thing I like to thank this place for, I'm no longer afraid of needles. I used to be totally, and they walked me through it, the doctors. One experience that I had that was so beautiful was one of the receptionists, I walked in and she said, "Sweetie, you're fine, just go ahead." I said, "Do you know who I am?" She said, "Yeah, you're Miss Woman. Go ahead, you're all set." And that did my heart so well, because they know you. And they take that time out to get to know you. And for that, I just want to tell you thank you, thank you, thank you.
Thank you, Ms. Womack. You know, it was about 40 years ago, the federal government also started a program called the National Health Service Corps. And that program it actually exists to today. And many of the providers that we have working at all of our sites, including myself in 1986 when I arrived, were members of this program called the National Health Service Corps. And the goal of that program is to bring healthcare professionals, physicians, nurse practitioners, and PAs to underserved communities. So back in this early 70s, that was the hope. And the hope was further that these providers would work and continue to work in these type of settings and not treat this setting like a clinic, but rather a private practice. So when I came here, my hope was that every provider that came would remain. And I think our retention of providers over the course of history for Optimus Healthcare is actually one of the best in the country. So given all that, what I'd like to do now is to move to the ribbon cutting. You might realize that we have actually 3 or 4 videos here. We're actually preparing a video for our 35th anniversary, as well as some marketing. So we're going to move over to the cutting ceremony, and then we'd like you to join us for food, hors d'oeuvres, and definitely a tour to see our new site. The old site is also very beautiful, so you're welcome to pass through that as well. Thank you very much.